Hi friends, welcome to Love Medics. Did you draw like this in your hands or in your notes? What is that? That is the ECG wave, electrocardiogram. Electrocardiogram means what? That is the electrical activity of the heart recorded from the surface of the body. This produces the positive or negative deflection waves. It indicates the specific electrical events of heart. Now the waves of ECG. P wave. This is the P wave. QR complex. This is the QR complex. And this one is the T wave. And U wave may be seen or may not be seen in the ECG. PR interval. This is the PR interval. And this one is the QT interval. And this segment is the ST segment. Now P wave. SA node produces the electrical impulse. That electrical impulse passes to the AV node that produces the atrial depolarization. Atrial depolarization means what? That is the atrial contraction. When the heart is contracting, it produces the P wave. Normal duration of P wave is 0.1 second. Normally, the P wave is upright in all leads except AVR. Now, QR complex. The electrical impulse from the AV node passes to the bundle of his right and left bundle branches and Purkinje fibers that causes the ventricular depolarization. Ventricular depolarization means what? Ventricular depolarization means ventricular contraction. So, the QR complex indicates the ventricular depolarization. Normal duration of QR complex is 0.08 second to 0.1 second. QRS complex in the limb lead, that means AVR, AVL, AVF, that leads helps to detect the electrical axis of the heart. Now T wave. T wave indicates the ventricular repolarization. Repolarization means ventricular contraction. This is the T wave. The normal duration of T wave is 0.15 second. This T wave is positive in all leads except AVR. The inverted T wave in third lead is normal. If the inverted T wave is present in other leads, that is abnormal wave. Now U wave. U wave indicates the repolarization, that means relaxation of the ventricular septum and the papillary muscles. Till now, we see the atrial contraction, ventricular contraction and ventricular relaxation. Now you think, when the atrium is relaxing, when the AV node passes the electrical impulse from the bundle of his right and left bundle branches and Purkinje fibers, that time ventricles start contracting. At the same time, the atrium start relaxing. That is the atrial repolarization wave. So, the depolarization wave of atrium is submerged in the QRS complex. PR interval. PR interval means from the beginning of the P wave to the beginning of the QR complex. It indicates the atrial depolarization, that means atrial contraction, and it also indicates the electrical impulse passes from SA node to AV node. The normal duration of PR interval is 0.12 second to 0.16 second. Next, QT interval, that indicates the complete ventricular electrical activity. In this QT interval, ventricles start contracting and relaxing. The electrical impulse passes from the bundle of his right and left bundle branches, passes to the Purkinje fibers, so the ventricles start contracting and the ventricles start relaxing. The QT interval measured from the beginning of the QR complex to the end of the T wave. The normal duration of QT interval is 0.40 second to 0.43 second. ST segment. This is the ST segment. It indicates the complete depolarization of ventricle. Depolarization means complete contraction of the ventricle. The segment between the end of the S wave to the beginning of the T wave, that is called ST segment. Now, question time. P wave indicates the atrial depolarization or atrial contraction. Normal duration of P wave is 0.1 second. Which wave is produced due to the ventricular repolarization? That means ventricular relaxation. T wave. Thank you.